Okay, now welcome once again. And it has been 1 week after your varicocele procedure, varicocele operation.
Yes.
Can you tell me how you understand you had this varicocele? What is your story? What happened? Please tell me.
So like first of all, I did the surgery like on the left side 7 years
Yes.
ago.
7 years ago on the left testis, first operation.
Yes.
Then
And then
what did you feel before the surgery? How do you understand you had the varicocele?
just the pain.
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 You
Like
had
mostly the pain. Like I have
Yeah.
like a lot of pain on my
Left
left
testis.
side.
Yeah. Then you have first operation. Then what happened?
So after like 6 months ago when I go work out in the gym and
Yeah.
I lift a lot of not very heavy weight, but I do a lot of pressure
Yeah.
on my lower part
And
Like-
it started again.
and start the like my right side hurts like very bad.
Yeah. So after first operation, for many years you have nothing.
Yeah, I have nothing.
Okay. Then you had this pain in the right side,
Yes.
and you come again, and also in Turkey, right? The
Yeah.
second operation done. So you have investigation again. Did they find varicocele again?
Like in Turkey or
No. I mean, what happened? Tell me.
no,
please.
they did not find anything. They said
Yes.
you're fine, but I feel the pain. Like how
Yes.
come I'm fine and I
Yeah.
have that pain?
Yes, you
It
have
doesn't
that.
make sense.
Then,
Then I came here like to check it out with you.
so you find me from internet.
Yes.
And when you come here, we also see varicocele in the right side, right?
Yes.
Big veins.
Yes.
And now after the operation, I see it's clear now. But in the right side, we take out very long segment veins, right?
Yeah.
We find them. I will show the pictures of them now. And you had some symptoms with urination. What were they? What were the symptoms?
So the symptoms is like weak stream urination.
Yeah.
When I urinate like that.
What do you mean weak? Really thin flow? What do you mean? Was it
Yes.
very slow? Were you spending too much time in the
Spending
toilet?
too much time and slow.
Slow.
Yeah, it takes a lot.
For
of-
example, how many minutes were you staying on the toilet?
Sometimes a minute, sometimes a half, like a minute and a half.
Yeah. So normally we are expecting a young guy to pass the urine in 30 seconds, for example.
Yeah.
But it was longer in your case, right?
Yes.
So you asked me to do a cystoscopy
Yes.
and to look inside. What will I see? And when I look inside, there was a stricture. So of course, I was expecting something because nobody will ask me, please look at the urethra and to see what's going on. So I was expecting to find prostatitis, which is we very commonly observe in varicocele patients. But in your case, there was a big stricture. So we opened the stricture, we cut it by our pole knife. We call it internal urethrotomy, and we do it and we put a catheter and you keep the catheter for 1 week.
Yes.
How was it? Was it very difficult?
It was very challenging, but I
Yeah.
made it. Like.
Yes. It was pain. It must be
Yeah.
painful.
Yeah, it's very painful. Like sometimes
Distress.
I couldn't sleep properly, so
Yeah.
stress and.
And did you have, for example, nighttime erections, such things? And how was the catheter inside?
Yeah.
How
I
did you manage?
Like I couldn't like I have to like change my position
Yeah.
during my sleeps.
But look, you have very big arteries, very nice, and now we have no veins. We take them out, so it's good that we have these arteries. It's very healthy. Testis here, and for the left side, it's the same. The veins are gone now. It's good. But of course, the real results will come when your pain is over. Do you feel any difference, any changes in the pain now, or it's still same pain? What do you think?
No, I start feeling the difference. I did.
Yeah, you feel the difference, right? Because we take out the veins. The veins are the real reason you are having this. And the left side was better because you have operated once, but in the right side there was huge veins.
Yeah.
We take them out and you will feel better and better by time. Yeah.
Yeah, it's very weird. Like when I went there to check out and they said you are fine, you have nothing, but I have pain. Like
Why do you think? It is because they did it in the standing up position, or was it cold over there? Why they cannot find this? I don't understand. What's your opinion?
Yeah, I think like, they're they're not spending more time to research and
Yeah.
like more. I think they don't have like a really good experience as you said.
Actually, it's true because normal urologists have to deal with everything. They do maybe 2 cases in a month, but I do maybe 20, more than 20, 25 cases. So this is my main business, main interest, main hobby.
Yeah.
So yeah, we find it. There are many cases like that. I always believe in what patient is saying.
Yeah, because we have pain.
Yeah.
That's the main.
And sometimes people feel the veins there. They feel it, they see it, but it's not the doctor. When they do, radiologists do the test, it may not be seen. So we have to spend time looking at these veins, and usually we find as the patient says. Okay, now we will look at your pictures. Okay, this is the cystoscopy. You see there is a stricture, yeah, it is very, very tight. Our instruments cannot go inside, but we see the channel is good, continuing. So what we do is we put some special wire first to not to lose the line. Then we have special instruments to cut the tissues, and yeah, now we open. This is the wire. We open it largely to prevent this stricture happening again. First, you kept your catheter for 1 week. This is good.
Yes.
Next, now you have to drink a lot of water and you have to make urine very much to keep it open.
Okay.
It will be very discomfortable, very distressful, but you will do it. You will go to toilet many times. And in the future, I recommend my patients, if you feel, because these strictures may happen again, they recur again. So why it happened? It may be because of some trauma. Maybe someone kicked you. Maybe you have a blunt fall in your this part.
I had a lot.
In the bicycle, you know the bicycle bar. You can drop to this part. Or in football games, football can come. And to prevent this re-happening, you have to make a lot of urine. If you feel it's getting narrower again, your urine you will change. You will see the urine caliber. The strength of urine will go down.
Yes.
And at that time, I recommend, it's not easy, but putting some catheter, we will show you. Okay, this is a catheter. So, this catheter, it is sterile, it is for this aim, to self-catheterization. You can open it, put it in the channel. Okay, it's not comfortable, it's not joyful, but it's doable. When you put it, you will tear the stricture from re-happening. As you here see, this you see that? Look, very tight. So it may happen again. And when you feel the urine stream is decreasing, you can put this once and it will be open. You will feel the changes. You can observe it with your urine flow. It's not easy but doable. I hope it will not happen again. You will not need again, inshallah. Okay, then other than that, in the varicocele part, very interesting story. I have many patients like that. The patient feels the pain, he sees the veins sometimes, but in the radiology department, they do the test in the laying down position. You are living in Canada, right?
Yes.
So it's a very well-developed country, high-developed country, but the health system sometimes a little compared to here, the strength of the system is a little low.
That's very low.
I don't know why. Maybe we are too fast. We are fastly improving and following every development closely, because Turkey, everything is fast in Turkey and cheap compared to well-developed countries. So people come from all over the world here for these techniques. So what we do, I do my own Doppler in the office, and what I see here in your vessels, you have really significant veins. This is right side, and significant reflux. This is left side. So we decided to go with the procedure, and
yes.
In the procedure, we really find very long segments of vein. This is your initials written by your own veins, and in the operation, these are really big veins. You know, you find me because of my technique, I am taking these veins out. In normal operations, you had this operation for your left side.
Yes, and still there.
They are still there because sometimes they don't disappear. So we take out these veins. In the operation, we find them first, and we deliver the testis and take these veins out. I was expecting to find, but they were really bigger than I expected. So we take out them completely. Now it's over. And you can say you feel, it's very early now, but you feel the difference of this pain, right?
Yes.
Yeah, it will be over soon. It will be better when you heal more. Thank you for coming. Thank you for choosing
Thank you so
us.
much. Yeah, thank you so much.
Yeah.
For your
And how was it? Okay, you also have some family members in Turkey,
yes.
so it's easier for you. But what's your recommendation to people who will come from Canada, from other countries? Is it doable? How can they manage that?
No, I think it's very important to come and treat yourself here. It doesn't matter whether it's easy or hard, but the technique you have, it's deserve it.
Yeah, thank you.
And it's not very hard to find your place. Just any taxi, anyone in the street can help you. You can ride the trains, public transportation, or.
And nowadays, Turkey is affordable with the prices.
Yeah, it's very.
Because I would try to keep the operation cost as simple, as low as possible, because they will spend time with the flight, with the hotels, everything. But still, it is compared to United States or other countries, it's still
yes.
doable.
It is.
Thank you. Thank you very much
so
for
much.
coming.
Thank you so much, Doctor.